first podcast. Well, my first podcast.
All right. All right. How are y'all doing?
Fantastic. How are you?
Great.
Oh,
Good.
wait, I'm talking to you.
Yes.
I'm fantastic, Christie. How are you?
Yeah, I'm doing great. This is
Fantastic.
such a beautiful place.
It is. And what a relaxing way to have these conversations,
Oh.
even though they're tough conversations to have.
Absolutely. Absolutely.
No, I'm glad you guys are here. Are you having fun?
Tons of fun. I mean, the people at the AdvocaSea program, they're so nice. We worked well together in our group settings. We're just having a great time.
Okay. Yeah, it's tricky to pull something like this off and like be actionable and be impactful and meaningful, because you guys are experts in your field.
Sure.
You know all of this stuff, but getting you together and start to share and talk about it, kind of brainstorm and organize all of the different things and kind of get everybody going in the same direction.
Right. I think all of us have a piece of the healthcare system, and I think
Yes.
that's what's been really valuable for me is learning more about Christie and Christie's role and how that impacts the ability of patients that I work with to be able to get their medicines, and maybe how I might work with somebody like Christie to be able to get access to patient care more, or what I need to teach patients as they relate to them being a better advocate for their own healthcare. So it's been really valuable for me to be able to kind of touch these different pieces of the healthcare system that I haven't really talked to. I mean, I come from that patient advocacy, patient nonprofit background, so I haven't had conversations with somebody like you. So I think this has been really valuable for me to meet people that are in these different spaces.
Yeah. Well, Christy, why don't you tell us a little bit about yourself and what you do and how you got into advocacy and all of those things, so the audience knows who we're talking to.
Oh, yeah, absolutely. My name is Christie Smith, and I'm a pharmacist by trade. I've been practicing for about 30 years, over 30 years now. And I've worked in so many different practice settings. So, from retail, specialty, home infusion, payers, calling on employer groups for payers, presenting clinical and financial information, coming up with solutions. And, I was just thinking about what you said, Alicia. I work for myself now. I work for, my company is called the Pharmacist Care Team, right? Because we are a part of the care team.
Yep.
And what's interesting about kind of what you said in collaborating with others is that as a pharmacist, your whole role is to educate. And that really is how I look at it. Now, some educators are better than others, right? And so, but perfecting communication between two parties, I am truly interested in what you have to say. Like, I got questions. I want to pick your brain on stuff. And so, I feel very passionate about it. We need to do that better as a community. And I'm just so excited that Melissa and Liz put this together. And look at the people in the room. I was going on LinkedIn already. I was like, okay, I need to follow with her because there's so much to know, and there's so many things that have changed in 30 years.
Oh yeah, you have to stay on top of it. So you have to have a network, and like you said, you lean on each other because there's pieces where you're maybe weak and somebody else is strong in that scenario. And having events like this bring you together, because some people, their weakness is they don't want to expose their weaknesses, right? So they'll just live with them, and that you need to be open and honest. Like, I don't know what that is. Help me understand that.
Right. Well, and something like, a pharmacist being part of the care team, I think a lot of patients perhaps just sort of consider, like, my pharmacist is the person that fills the script, but not the person that has the knowledge that I may need in order to have a much better appeal, or that maybe there's a drug interaction that I really didn't know about because, I have a provider that helps me with this, but I have a provider that helps me with this, and they don't know that those drugs don't go together. So I think it's a really underutilized resource and an underutilized source of patient education. And so I always love to work with pharmacists and to be able to kind of have them pulled into that care team in a very, very different way. Because you're right, that is your job as education, and to have it's so much knowledge about all these different areas that I don't know that patients always take advantage of.
Oh, absolutely. You know what? They just don't know. Like, people literally think that all we do is fill drugs behind a counter, and they just don't know. And it's part of what's really great about this body of this collective, is just that we can help educate you now that that a pharmacist can do freaking anything.
I love it.
Alicia, right?
Yes.
Tell me a little bit about your background. You said you were in patient advocacy, nonprofit. tell me a little bit more about that so the audience knows where you're coming from with your expertise.
Absolutely. Yeah. I'm Alicia Barron. I'm the executive director of the Infusion Access Foundation, and we are a patient-facing nonprofit organization that works to ensure that people living with chronic and rare diseases have access to infused and injected medications. And those are definitely the medicines where we see a lot of insurance denials and access issues because they tend to be a little more expensive, and they have that added, if it's an infusion, that added cost associated with having a nurse that's having to provide that care. So extra cost to the system. And so definitely a lot of access issues. But, I came to this because my dad had multiple sclerosis, and I have a family connection to chronic disease, and I saw how this affected my family. I see how this affects all these families and what barriers there are. And this is a way for, as much as I love helping patients one-on-one, it's fabulous. I really want to see macro level change, systemic change that happens so that we can change policies that are friendlier to families that are affected by chronic and rare diseases, because that's really where we're going to make the most impact, I think. Again, working with somebody one-on-one is fabulous and definitely impacts their lives, but let's try to change it for the whole system. Let's try to change it for everybody to make it so that our system is friendlier to the people that really need it.
Yeah. No, the healthcare system is scary to the average person.
Yes.
And so they need to have a system that's friendly to them, right? Otherwise, people avoid the healthcare system, right?
Yes.
And we talk a lot about non-compliant, or you get, people have just bad attitude towards the healthcare system in general, and there's probably good reasons for that, but there are also very, very good treatments and very, very, very good therapies that can really improve your quality of life.
Absolutely.
But if that's such a barrier and it's just a bothersome to deal with, people, they can't afford it. People just choose.
Right. Well, and that's the problem with saying non-compliance isn't somebody saying they don't want to take the drug. It's saying that there's a barrier to the drug potentially.
Right.
It might be cost. It might be that they don't understand the medication. And so there's a lot of factors that are at play. So, sometimes patients get a bad rap for non-compliance.
Yes.
But it could be that they're also having to fight for this drug, and their insurance company has put so many barriers in place, they can't even get to that drug. And frankly, they've lost the ability to continue to fight for themselves because they're living with a rare disease, they're in pain, they're not sleeping, all these things that affect their ability to actually get to the drug. So non-compliance is kind of a dirty word a little bit in my mind.
Yeah, no, that's good to know.
It's kind of blaming the patient for something that might actually be a systemic issue that you need to catch.
I agree. That's great. That's great. That's a great differentiator there, so that we don't use that word incorrectly. And
I mean, there's some people that just don't take their medicines too, but
of course, there always is, but that's usually not the case. I don't know of anybody who has an illness or condition that says, I just don't want to get better.
That's right. I was thinking that same thing. I mean, people want to be healthy.
Yeah.
They just don't know how to access the system, or they've gotten like the wrong treatment, misdiagnosis, and they're just overwhelmed and frustrated.
Yeah.
Yeah.
They want to get back to quality of life. They want to live their lives.
Yeah.
And unfortunately, a lot of times you can't get there unless you do find the right treatment that gets you into remission or gets you to that place where you're able to go back and live your life as you want.
And sometimes, that just requires doctor shopping. I mean, I hate to say it like that, but sometimes you do have to shop around. I tell the people the same thing when you start a new medication. Now, listen, it might not work, but that doesn't mean that there's not something for you.
Right. Yeah.
Because medicine affects everybody differently. Literally everybody, your body differently. And so you do have to get passionate about advocating for yourself. Yep. And one of the great things that I've seen throughout, this conference is examples of patients that have worked with advocates like Alicia that have become empowered, emboldened.
Yeah.
And then they go out and they start their own foundation or advocacy team. And so there's a beauty in a struggle, and when competent professionals are helping the system.
Yep.
And there's a lot of people who have journeyed down those roads, who have done the nonprofit, who have had the passion and stuff, but working together. I know something, I feel like I'm kind of an outsider in this. I'm not in this realm, so I see everything as an outsider, and I try to give Liz and Melissa a contrast to the way I see things.
Yes.
And it's usually from a point of ignorance, but it's good contrast. So you can have a lot of passion and a lot of zest to get these things done, right? But if you can get teamed up with like the Infusion Center, Access
Infusion
I know
Access
NICA.
Foundation.
What's the other one? That's
Infusion Access Foundation.
that's
yes.
associated with
Or
NICA, right?
One of your, we are a sister organization.
Sister
to them.
organization.
Separate organizations. We are two different people.
Okay,
I'm
yeah, of
working
course.
on making that clear.
No, it is clear. It is clear. They got a head start.
They did indeed, yes.
Yeah.
And we work very closely with them because of folks like Ashley who have infusion centers that our patients are going to, and as another care model for patients to be able, so they can go to a place that's more convenient for them and oftentimes costs a lot less than going into a hospital system to get those medications that require a nurse to infuse it. Yeah.
Okay, perfect. Well, that's great to hear.
Not to add somebody else into the mix.
Yeah, no, I got you on
I was
camera
getting
there.
a coffee.
I think. Let me hear it. See if you can
Okay.
add. Talk
Can
on
you
the
hear me?
microphone.
Talking to the microphone.
Can you hear me?
Yep, I got
Okay.
you. So you're
Sorry.
on there. We were
Late to
we're-
the game.
You're good,
It's okay.
but we were
Never
doing no
late.
headphones
Too
to
late,
keep our hair pretty.
Although I might want one for mine because it's like the breeze is blowing my hair like this into my face. I'm like,
Well, tell us a little bit about yourself, Ashley,
Yeah,
and what
absolutely.
you do.
So I am an infusion nurse by trade. Been in this industry for over 15 years. I started in the neurology space, and really just fell in love with the industry, the types of patients that we treat, and the business model. So now I'm the co-founder of Local Infusion. We're an ambulatory infusion clinic. We have over 43 locations in 10 different states and are rapidly expanding. And my goal is to provide a better patient experience. Like Alicia mentioned, it's a lower cost, 2 to 3 times cheaper than the hospital. We offer private rooms, evening and weekend appointments. So it's really a better patient experience, and that's a better outcome overall for the patient.
cushy chairs, blankets, a snack menu. I
Yes.
mean, honestly,
It's like a
I wanna-
spa
I wanna
treatment for
go.
infusion patients. Yeah.
No, that's great. Yeah,
love that.
I think there's more to treating a patient than just here's your meds, take it, go home.
Absolutely.
Right,
We're,
the
we're
way
a
you
full care
treat
team
them.
for the
Yeah.
patient.
Yeah,
We
well,
believe
and it's
in
a
that.
really great relationship. It's another touch point, just like your pharmacist is part of your care team, your
Yes.
infusion nurse starts to be part of your care team as well.
Absolutely.
You have another person that's touching your case regularly, talking to you regularly about your health. That's fantastic. That's
Advocating
even better.
challenges when they come up.
Yeah.
I mean, so many times payer challenges come up. You know,
Yeah.
a patient may switch employers or get new insurance. And it's hard to navigate that, especially when
is.
patients have been on therapy for 10 plus years. Some of the patients in our centers I treated in 2011. So these are people that I've known and kind of, grew up with over time, and things come up. When they change insurance, it can be tricky, and the goal is to keep them on their therapy that's working.
Absolutely.
And patients, Ashley, if I can say, love their infusion nurse.
They do.
Yes, they do.
That I mean, you're the face of the patient.
Yes.
When a
Also-
pharmacist, I'm sorry,
No,
I'm
go ahead.
sorry. When a pharmacist is interacting, say with an infusion suite, the infusion nurse knows everything
Mhm.
about the patient.
Yes.
So love me some infusion nurses.
That's why I fell in love with this
Yeah.
industry. I mean,
Mhm.
it's so different than, coming from the ER or something where it's just very transactional. Yes, you may save someone's life, but you never see them again. They go up to the ICU or to the floor. This is completely different. You develop those relationships with the patients, when they're getting married, when they have a child, when their, daughter's birthday is, and you really become just an integral part of their healthcare team. So
And you would want to create an environment where these patients want to come
they
in.
want to come.
They want to
Yes.
come in, catch up with
Absolutely.
you, get their treatment.
It takes their mind off the fact that they have a chronic condition
right.
and that they're here getting an infusion because they look forward to the visit. It's an amazing thing.
Right.
It's such
It's
an
the magic.
opportunity as well because like you said, you have even if you're a commercial pharmacist, you have a few minutes with a patient.
absolutely.
You go to your doctor's office, they give you 10 minutes, and we know that's the way it goes. Somebody's sitting in an infusion chair for an hour, sometimes several
6.
hours, 6 hours, 8 hours.
Yes.
What a great opportunity for that infusion nurse to be able to catch when there is educational gaps or there's
Absolutely.
needs that are not being discussed or that maybe they don't even know that they could be getting help with. Like, I don't know how many people I've talked to that have no idea that patient assistance programs exist
Oh,
for their
yeah.
medication.
Absolutely.
You know those
Grants,
infusion
different-
nurses.
yes,
Saying,
absolutely.
let me pull Ashley's team member in here to get let's talk about this. And so I think it's a real underutilized resource or maybe like unknown resource.
unknown.
Yeah.
And the
Wow.
adherence, itself
Adherence
to the
rate goes up.
medication
Yep.
goes
Oh,
way
yes.
up.
Wow.
Yeah.
Well,
In
I'm
spaces.
excited that you guys are all here.
Yes.
Thank you for coming and sharing your knowledge and meeting new people. And I think they're calling you back in to
Oh,
do
okay.
some
Got
more
the
work,
hook over
to
here.
more
Is that it?
workshopping.
Is that
and
the signal?
thank you for sitting down. I
Yeah,
hope you're having a
thank
good
you.
time.
We're thrilled to
Thank
be
you.
here.
Thank you.
It's
Thank you
amazing
for
having
Bye-bye.
having
us.
us.
Bye.